All right, today we're jumping into a topic called hirsutism. Now, it's a condition that's defined by excess hair growth, but for the many young women who experience it, it is so much more than that. It can be super distressing, and it's also way more common than you might think. So, let's get into it. So here's our plan. We're going to start with the basics. What actually is hirsutism? Then we'll dig into the hormones behind it. After that, we'll talk about how you get a proper diagnosis, and we'll wrap up with a whole toolkit of ways to manage it. Okay, first things first. What are we even talking about when we say hirsutism? We're going to get clear on the clinical definition, for sure, but we also want to talk about the real personal side of this condition. And right off the bat, I want you to see this number. Hirsutism affects somewhere between 5 and 15% of women. That is a huge number. So if this is something you're dealing with, please know this. You are so far from alone. This is a shared experience for millions. And this quote, it really gets to the heart of why this conversation is so important. This isn't just a cosmetic thing. It has a deep, deep emotional and psychosocial impact, especially for young women who are already dealing with all the other chaos of becoming an adult. The distress is absolutely real. Okay, so what's the official medical definition? Well, it all comes down to two key things: terminal hairs and a male-like pattern. So we're not talking about that fine, light hair a lot of people have. We're talking about coarse, dark hair showing up in places like the face, the chest, or the lower back. And that's a really important difference to understand. You've got vellus hair on one side. That's basically peach fuzz, you know? It's soft and light. But what we're focused on here is terminal hair. It's coarse, it's pigmented, and here's the most important part. Its growth is fired up by hormones called androgens. Okay, so if these androgens are the main culprit, that begs the question, right? Why is this happening in the first place? Well, the answer is all tangled up in our hormones and the natural way our hair grows. So think about it like this. Every single hair on your body is on a cycle with three main phases. There's the anagen phase. That's when it's actively growing. Then there's the catogen phase, which is a short little transition. And finally, the telogen phase, where it just rests before it falls out. And how long a hair can get really depends on that first growing phase, the anagen phase. And now, let's bring in the main character of this whole story, androgens. We're talking about hormones like testosterone. They are the primary bosses when it comes to your hair. They have this incredible power to flip the switch and turn that soft vellus hair into the coarse, dark terminal hair we've been talking about. So, where are all these extra androgens coming from? Well, take a look at this. In the huge majority of cases, we're talking 70 to 80%, the root cause is something called polycystic ovary syndrome, or PCOS. The other causes are way, way less common. And that tells us something really important. Hirsutism isn't just about hair. It's often a major clue for this much bigger endocrine condition. Which, of course, brings us to a super critical step. Since the hair growth is usually a symptom of something else going on, getting a proper diagnosis isn't just about the hair, it's about getting a full picture of your health so you can actually make a plan. So what happens when you go see a doctor about this? Well, they're going to do a really thorough evaluation. They'll want to know your full medical history, any meds you're on, what your menstrual cycle is like, and even your family's health history. They need this complete picture to start connecting the dots. Now, to make things objective, doctors use this special tool called the Ferriman-Galway score. It sounds complicated, but it's basically a way to rate the hair growth on a scale from 0 to 4 in 9 different areas of the body that are sensitive to those androgens we talked about. And that score isn't just a number. It tells your doctor what to do next. A score from about 8 to 15 is considered mild, and you might start with some cosmetic treatments. But if the score is over 15, that's considered moderate to severe, and it's a big signal that they need to dig deeper to find out why there's an excess of androgens. Okay, so once you have a diagnosis, the big question is, what can you do about it? And that brings us to our final and honestly most empowering section, the management toolkit. Let's look at all the different strategies for gaining back a sense of control. You know, a lot of the time, the very first tool in that toolkit is lifestyle change. And for women with PCOS who are overweight, the results can be pretty amazing. Just a 5 to 10% reduction in body weight can lead to a 40 to 55% improvement in hirsutism. It works because it helps reduce insulin resistance, which then helps lower those androgen levels. All right, beyond lifestyle, you have physical methods that go right to the source and target the hair follicle itself. These are all about removing or reducing the hair that's already there. Let's look at two of the most common ones. So you've got a couple of main options here. There's electrolysis, which actually destroys each individual follicle. It's permanent, which is great, but it can be slow and pretty painful. Then you have laser, which is way faster and can cover bigger areas, but it's not technically permanent and it works best for a specific combo, light skin and dark hair. So as you can see, each one has its own list of pros and cons. Okay, so while those physical methods are great for dealing with the symptom, the hair, hormonal therapies are designed to tackle the underlying cause. The whole point is to either slow down your body's production of androgens or to block them from affecting your skin and hair follicles in the first place. Now, this is so important to understand if you're considering hormonal therapy, the timeline. This is not a quick fix. Not at all. Remember that hair growth cycle we talked about earlier? Because of that, you might not see any real improvement for about 6 months. And the maximum effects? That could take 9 months, maybe even a full year. Patience is everything here. And the good news is, there are quite a few hormonal options. The combined birth control pill is often a first-line treatment. But there are other medications too, like spironolide or finasteride. Even metformin, an insulin sensitizer, can help. They all work in slightly different ways to get those androgen levels under control. So, what's the big takeaway here? Managing hirsutism is almost never about finding one magic bullet. The most effective approach, time and again, is a combination strategy. You blend the lifestyle changes, the physical hair removal, and the hormonal therapies to attack the problem from every possible angle.
And all of this brings us to one last really important question. When you think about the deep emotional toll and the fact that this is a long-term journey, well, it can be an incredibly tough road to walk. So maybe we need to think beyond just the clinical treatments and ask ourselves, how can we as a society better support people who are navigating this very long and very personal journey?